most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Shaw, physical therapist.
Brad Hanning, physical
Because
therapist.
we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about back pain, sciatica. Can a simple leg wedge take away your pain? This is not a leg wedge. This is our giveaway, by the way. This is something I've been pondering a while, Brad. Pondering. I like that word.
What, the bed?
No, thinking about back pain
Oh.
and how it gets better and why it gets better. And we've had some discussions, but we're going to go over this today, why we think a leg wedge might help you, or if you could just use a couple pillows too at
Sure.
home. So.
Mm-hmm.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. I got to get my breath back. You can also go to bobandbrad.com. That's where the giveaway will be found. Or you go to Facebook. It'll be pinned to the top of the page, the giveaway that is. If you want 60 seconds of us, go to Instagram or Twitter or TikTok. We got it 60 seconds a day. This is the giveaway. And if you have back pain or sciatica, this is something you might want to consider. Absolutely. Because this is the back pain sciatica mattress, if you ask me. Brad's got spondylolisthesis. Did I say it right?
Spondylolisthesis. Yeah, but it has really changed my life as far as sleeping on my back. I just can't say enough about it.
Yeah, it's got 700. This is just a sample, by the way. This isn't a full mattress. You go get this little mattress, you got to lay on it. It's got 700 individual mattresses. It's got air channels. They're also giving away a couple pillows. So if you don't win a mattress, you might win a pillow. Their pillows are very unique too. It's got individual foam squares, but it's got springs inside of it.
It's supposed to be cooler that way.
Yeah, it's cooler that way, and it's it's not like a down pillow. Like when you push down, it stays down.
Yeah.
So
that's why it's down.
That's the old joke from
old school.
All right. First thing this is the wedge that I'm talking about. Where we've used this wedge typically is with people when they start off with that back pain. Brad uses this all the time. If you got a flare up of back pain, a lot of people will recommend to lay on your back. A lot of times put a cold pack underneath the back and put your legs up.
Right.
And this is a good position. I've recommended this sometimes for people who are unable to sleep in their bed and they've been sleeping in a recliner instead.
Sure.
I've had them try to ease their way back into bed by using a wedge first.
Right.
It's worked for some people. For some people, it just did not at all. They had to stay in the wedge.
You know, if it is for back pain and you don't have a wedge, you can lay on a carpeted floor and then a piece of soft furniture that you can put your feet up on the furniture.
Like an ottoman or a chair.
Yep.
Yep.
So your calf and your foot will be up on the chair, and then your hamstrings will be up against the chair. So you're laying.
You're basically 90-90.
Yes.
Why don't you show Brad just with the wedge?
Yeah. So this is what I do. Like Bob said, if I get carried away with yard work or something and my back is sore, and I've done this right in the middle of the day. It's like, if I don't do this now, I'm going to have a sore back for the next 2 days.
Just to calm it down immediately.
And then I can go back to work, but at a lesser level. Now everything's black, so we'll go this way so you can see this. I put the cold pack, and I use a gel one so it's comfortable, and it squishes into my back, and then I have my wedge, and I lay here, and about 15 to 20 minutes, and it's very comfortable, very relaxing, and it really makes a difference.
And you've mentioned to me, Brad, that you've even done it at night, where you've fallen asleep like this, and you wake up a couple hours later and you kick it out.
Exactly. And I always have one of these in the clinic, and I would say 90% of the time on people with back pain that I have this with, they respond very well. Yeah. Not 100%, but vast majority. So
it's a good universal one. They aren't that expensive.
No.
So I feel good in recommending one.
Yep.
But this is where I'm thinking, hey, there's some other uses for this.
Sure.
So sometimes with back pain and sciatica, we have people start the McKenzie method, and sometimes they're not able to lay on their stomach flat. We like to have them start by laying on their stomach like this, and they're not unable to do it. So this is a great way to ease into it. So basically, you're going to lay on the wedge itself like this, and I think even if you have pretty severe back pain, you'll be able to tolerate this.
Right.
It's just a very comfortable position. So you're going to try this first, and then if that feels okay, I want you to take your elbows and prop up onto them. So you're going to get up a little bit higher.
Sure.
Now, what this is doing, these are putting the back muscles on slack. and
right here.
so they're nice and relaxed, and they really can calm down. A lot of times, if you can do this for at least 90 seconds, no movement for at least 90 seconds, and then you can start doing a little bit of wiggling, just get a little bit of movement, and then you can go up and about your day and see how it works out.
And I want to just say, Bob, you're looking for comfort. You're only going to do these if your back feels better while you're doing it. You
Yes.
just feel it relax. It's calming down. You know you're doing the right thing then.
Now, if you're having pain on one side, let's say it's on my left side,
Yep.
the thing you can try is try what we call the roadkill position. So I'm going to actually take my foot and put it against my knee,
Right here.
on the painful side.
Yeah.
I'm taking the painful leg and bending it up into a angle and putting the foot on my knee of the side that's not painful. This relaxes the back even more on this side. So give that a try and see, if you're having sciatica and pain down the leg, and this doesn't take the pain out of the leg, try this and see if it does.
Right.
Because we're always looking to get that pain out of the leg, into the back, and then it goes away. So you need to get the pain out of the foot and ankle first before you can get it to be eliminated.
So you could do this. You could do it on a bed if it's a firm bed and you cannot get to the floor. Ideally, on a carpeted floor is the best place, or unless you have a treatment table, which most people do not.
Yeah, some people are going to have trouble getting down to the floor.
Right.
So that's why I do it on the bed. Even in this position now, you can even prop up on your elbows now too after you've been there for a while, and even put your chin up onto your hand like this. You're really putting the back on slack then. So now, let's say that feels better, or maybe it doesn't feel better. You can also try what we call micro press-ups. These are small press-ups. These are good for someone who has maybe a little bit out of shape and hasn't been doing these, Brad, because this brings you partly up already.
Sure.
So I got my hands here on the sides of it, and I start just doing gentle press-ups like this. And this is so easy to do as opposed to if this is not in place, Brad, and I have to go up like this and do an actual push-up.
Right.
That's a lot harder to do. This keeps the back a lot more relaxed. So little micro press-ups like this. Again, we're looking for it to feel better, that the leg pain is getting better, that the back is feeling even better.
Right. You're not going to progress through this video doing this if it's making things worse, particularly down the leg. Only if it's the other way. If it is making it worse, we need to make some adjustments, or it just might not be ready for it.
Now, the final exercise would be to do full press-ups off the wedge here. And I guess the final exercise, Brad, would be to then progress to taking it out of play.
Yeah. Put this in the closet.
And now, now that you're out of that, you want to go start to do the same progression. Try maybe prop on the elbows.
Right.
Maybe try roadkill. Then try micro press-ups.
Yep.
And then try full press-ups. Now, again, I don't care if you have sciatica. I don't care if you have just regular old back pain. You can give these a try. The only thing that I would say is if you have Brad's spondylolisthesis, and you want to say it again?
Spondylolisthesis. Or
spinal stenosis.
Yep.
I would probably hold off on doing those because it probably won't feel good. It probably is not going to do what it's supposed to do.
So this is the first time we've actually did a video for this using the wedge in this manner, I think. So this is another option just to make use of something like this. If you do have sciatica and these exercises don't seem to be working well, just go to our playlist of sciatica and you'll see other videos, and you have a very good chance you're going to find other options that are going to help.
Well, I hate to even mention this, Brad, but we did a full program on sciatica on our website, but it's not up yet, and it's probably going to be 2 to 3 weeks before it is. So I don't want to get too excited.
But that is really going to be the cat's meow.
Yeah, that's we got 40 some videos on sciatica alone, and we go from start to finish. We talk about every aspect you should know to make your sciatica better.
And the nice thing about it is they're all titled, so it's all in certain areas. So you're not going to watch all of those.
No, you go through the titles and you go, oh, that one pertains to me.
Yep.
And
Exactly.
each video also has a PDF with it, which means you can actually go in and print out what we talked about in the
Yeah.
video. So you don't need to listen to us more than once. You just have to watch the video and
And
print it out.
everyone's in favor of that,
Yeah.
Bob. We do not want to cause more people going to the psychologist and the therapist
Right,
to
right.
get over.
Get over
As a
Bob
matter
and
of fact,
Brad.
this is something I got to tell you this, Bob. I was at the hardware store. His name is Bob too, and I know the
Sure.
owner. And he started running at age 60, so he started watching our videos to become a better runner. And 11 o'clock last night, which the night before, his wife was hollering at him. And she said, Bob, turn Brad down, because he was listening to our videos. and they're on
We're causing dissension in the household.
Yep, so it's a spousal problem, so we apologize.
And this proves my next point here. Brad and I can fix just about anything.
Except for
a broken heart or a broken marriage.
Yeah.
But we'll work on it, right, Brad?
Right. I got to
turn us down. Thanks for watching.